Join Pharmacodynamics' circle of trust and save up to 50% on your medicine. Pharmacodynamics, effective, affordable healthcare.
Between 10 and 40% of women develop postnatal depression. If one takes the lowest figure of 10%, there are at least 50,000 new cases of PND per year in South Africa, and many moms don't seek help.
Looking back, all the emotions that you feel at that time, you know you've got a new baby, extra responsibilities, you're sleep deprived, you're not giving attention to your other children, and I think, or your husband as well, you know, he's also there, but you're not even thinking about him because it's just children, and you're tired, and you don't even have a minute for yourself. So I think all those emotions just snowball, and you find yourself at the end of the day in this dark hole, and you can't get yourself out of it. At that point I needed help because I didn't see the light at the end of the tunnel. I just saw doom and gloom.
Postnatal depression is a more serious illness than baby blues, and the symptoms are more severe and last longer. The disorder is insidious and debilitating.
PND did have an effect on my relationship with my husband, obviously because I felt very low, and I think for me how I deal with emotions is I block everyone out. Luckily, Henry is very supportive, and he encouraged me to seek help the first time around, and also after the third baby was born, almost immediately he said to me, listen, if you feel depressed, please tell me. I'll phone the doctor immediately.
Seeking professional help is the best solution for treating or managing postnatal depression. Because its symptoms can vary and moms may not recognize it, a healthcare professional can be objective.
Postnatal depression occurs, on the one hand, because of the strong physiological changes that take place in your body through the process of pregnancy, childbirth, and lactation, where the milk is coming into your breasts. And that causes turmoil in your body with your hormones and your biochemistry. On the other hand, there are some psychological and social issues that put you at risk for PND. For example, poverty, where there's very little support, even amongst people who are not in a deprived situation, lack of support is one of the biggest factors for having PND. However, a history of depression, especially during the pregnancy, is the greatest risk factor.
Treatment may require medication, and professional advice needs to be sought regarding what drugs can be safely taken during breastfeeding. Talk therapy is also beneficial.
The treatment for postnatal depression and anxiety starts off with an assessment. You can go to anybody who is familiar with the condition, be it your clinic nurse, your GP, a psychologist, even a psychiatrist, and get an assessment. If you do have PND, then there's three options. Number one is to go to individual therapy. Supportive therapy where you can talk about it and you can express yourself and get the input that you need of how to manage it. If that isn't helping you as much as it should be, then you could join a support group. And support groups are invaluable in helping women recover from PND because what they see is that other women also suffer from it. It normalizes their experience and it makes them feel that they're not alone. If neither of those seem to be getting you to the place that you need to go, then you may need medication. Medication is not a big deal. Let me emphasize that for postnatal distress and anxiety. It can be the blessing that you are given that will fix you soon, and you need to get better because you've got a family to take care of. So even if you're reluctant to get help because of your baby. He or she needs you.
Almost all women find great comfort in attending support groups where they can share their painful feelings with others, knowing that they will not be judged as bad mothers.
The treatment I received for PND was medication on both occasions. It helped me cope with my situation. It took about 2 weeks for me to feel normal again, but if you think you suffer from PND, please go get some help. When you're done with the treatment, when you wean yourself off the medication, you're like your old self again, and it just gives you the tools to cope with this overwhelming feeling that you have. So, yeah, get help, get treatment, talk to someone.
There is no shame in postnatal depression. While the condition may be out of your control, treating it is not. Help yourself and your family. Speak up and get loving support.
Join Pharmacodynamics' Circle of Trust and save up to 50% on your medicine. Pharmacodynamics, effective, affordable healthcare.